Good evening, St. Lucia, and welcome back to the Command Center for Information on St. Lucia's COVID-19 response. We are here this evening for the latest update from Prime Minister Honorable Alan Chastenet and Chief Medical Officer Dr. Sharon Belmar-George. We continue to thank all our partner stations who are carrying this broadcast with us simultaneously. Before the Prime Minister addresses you, I now turn to Dr. Belmar, who will provide a summary of the current situation in St. Lucia. Dr. Belmar.
Thank you. Good evening. From January 2020, the Ministry of Health and Wellness has undertaken a series of actions as part of the overall strategy to initially prevent the introduction of COVID-19 and within more recent weeks to contain its spread after the first case was diagnosed in country. All these measures have been part of a deliberate effort to reduce the pressures which local transmission of COVID-19 would place not only on the health sector, but also recognizing the pressures this would place across sectors and interests nationally. To this end, there was the introduction of travel restrictions, which were widened over time in tandem with the spread of COVID-19 globally. The introduction of facilities and services dedicated to care and treatment of both suspect and actual cases of COVID-19. The establishment of facility-based quarantine sites, the commencement of national testing for COVID-19, intense public awareness and education, the national scale down and a national curfew to support a policy of social distancing. All these measures were undertaken as part of an overall public health strategy to contain the spread of COVID-19 among our citizens. On March 13, 2020, our first case of COVID-19 was diagnosed. The second case was on March 14th, and the third, March 16th. The fourth on the 28th of March. On March 29th, 5 cases were diagnosed, and on March 30th, an additional 4 cases, bringing our national total to date to 13 diagnosed cases, all diagnosed within approximately 2 weeks. Though the Ministry of Health is actively directing persons to testing and care, this trend in confirmed cases is of concern. Apart from indicating that local transmission is established in St. Lucia, it also indicates that the required infection prevention measures are not being adhered to as recommended by the Ministry of Health and the World Health Organization. As the Ministry of Health, our urgent single priority at this point is to significantly slow down and contain community spread of this virus to protect the health and safety of every individual. As such, more drastic measures are now necessary to reduce the impact at this stage.
Prime Minister.
My fellow St. Lucians, we find ourselves here again tonight after addressing you on Sunday. And since then, we've had 9 additional cases, and we believe confirmation that we have community spread. As a result of that, after discussions with my cabinet colleagues and also with the relevant Ministry of Health directors, we have determined at this point that we have to expand our shutdown of the country. So as of 5 a.m. tomorrow, every person shall remain confined to their place of residence, inclusive of their personal yards. In essence, we're going to put into effect a 24-hour curfew. A person can only leave their place of residence upon written authorization by NEMO, inclusive of essential services. People are not permitted to go to the beach, go for a walk, or to visit their neighbor. People will only be allowed to leave their place of residence for medical emergencies. Supplies will be provided to the poor and vulnerable by NEMO, and police persons who need emergency supplies from NEMO can call 311 for assistance. I'd like to repeat that NEMO will take charge of the implementation of the shutdown and the delivery of items to the poor and to the vulnerable. The items are the basket of goods as determined by NEMO. For clarity, supermarkets will not be opened tomorrow, and this shall remain in effect until April 7th, 5 a.m. The following public health facilities will remain open during this period: the Groselet Polyclinic, 8 a.m. to midnight; Babonneau, 8 a.m. to 4:30; Leclerc Respiratory Clinic, 8 a.m. to 4:30; Castries, 8 a.m. to 4:30; Bexon, 8 a.m. to 4:30; La Croix-Mingo, 8 a.m. to 4:30; the Dennery Hospital, which also is a respiratory clinic, 7 a.m. to midnight; Micoude, 8 a.m. to 4:30 p.m., Vieux-Fort Respiratory Clinic, 8 a.m. to 4:30; the Soufriere Respiratory Clinic, 24 hours; Anse-Leray, 8 a.m. to 4:30; Canneries, 8 a.m. to 4:30; Victoria Respiratory Hospital, 24 hours a day; and OKEU for 24 hours a day. The Cabinet had to make this decision based on the evidence at hand and also recognizing the dilemma that we're in. In essence, we still remain in control of our own destiny. We can still get through this with minimizing the loss of lives, but it's going to require a more stringent approach to social distancing. My fellow St.Lucians, the difficulty at hand is we have two choices. We can go through this very difficult and onerous curfew and remain in control of our destiny. And by in control of our destiny, what we mean is we can help determine how many people are going to lose their lives. That's through our efforts. The other alternative is to allow the disease, the virus, to spread quicker. The result of that is that it's going to put tremendous amount of stress on our health services. And even though my government, your government, has done everything it can to prepare for this eventuality, we're reminded every day when we see governors of New York and governors of Connecticut, leaders of other countries that are much larger and much wealthier than St. Lucia, struggling to be able to get resources to deal with the number of cases that they have. If we allow this virus to spread uncontrollably, then the number of people that are going to be requiring hospitalization is going to be well beyond our means. And our means are limited in that even sourcing additional ventilators, sourcing a different, more protective equipment for our nurses and police officers and our doctors becomes restricted. So when I say that we can stay in control of our destiny, is we must do everything collectively together right now to prevent us to get to that eventuality. And getting there is a real possibility if we do not address this situation significantly. So when we say that we're confirming that we do have a community spread, it means it's amongst all of us. And the only way that we're going to be able to win this war, and winning this war is by limiting the number of St. Lucians who potentially can die because of this virus, is by acting now. So we're all concerned about what confinement to your home means. The boredom, the frustration, and the anxiety that it's going to create. And it's something that we're not accustomed to doing. But I'm appealing to all of us to be able to find that inner strength, to be able to make it through the next 7 days, and what other actions may be required of us post the 7 days. Because the fight has only just begun. We only now have the cases amongst us, and we know that the enemy is right in front of us. We don't have to guess anymore. We're seeing what's taking place in Martinique and many of our sister islands, countries around us. So it is real. And we must defeat this for our family members, for our neighbors, our friends, and for our countrymen. We owe it to them. The people who suffer from diabetes, people who suffer from hypertension, people who already have respiratory ailments, the elderly in our society, people with low immune systems. We must do it for them. Many of us may not even know that we're going to be infected by corona, but we're going to carry it. So the only way to protect everyone is for everyone to act as if the person that you're interacting with has corona. That's the level of precaution that you must take. Mothers, I'm appealing to you. Simple things like people not walking into the house with their shoes, that instantly taking your clothes off and putting them in a separate location, taking showers and washing your hands, and making sure you keep your yard and your home as cleansed as possible. If no one in your home has it, and you practice these simple things, I assure you, you have the best chance of being able to survive what is taking place. What have we seen from the global experience? We're seeing countries much wealthier than us that are struggling. Italy, over 10,000 people have died. United States of America, I believe that they've broken 1,500 people who have died. And just tonight, they were suspecting that they could have as many people as 100,000 to 200,000 people that potentially are going to die. Germany, Spain, countries much bigger than us are struggling. I believe that when the CMO speaks again, she'll remind you, we have the power to defeat this virus, but it's going to take strict discipline to be able to do so. And it is going to take hardship. But I assure you that the hardship of being confined is much less painful than watching a loved one die. And that's the reality that we have to be able to face tonight, is the likelihood is that there are going to be deaths in our country. And what we must do is everything within our power to minimize that. So in essence, we are in the fight for lives, and we can still control our destiny. And sadly, I must say to you that we have to expect more cases in the near future. I've indicated to you as your Prime Minister that my cabinet, your government, have been focusing on corona. Told you our priority number 1 has been corona, our priority number 2 has been corona, our priority number 3 has been and still is corona. We must first bring this virus under control and eliminate the threat that it's causing to the lives and to the economic activity in our country. Any level of stimulus at this point is not going to solve the problem, because we cannot go out to work. We cannot interact. We must practice social distancing. So, to win this fight, we must follow the protocols that the CMO has given us, which are well thought out by the WHO and PAHO and CAFA, and by global experiences at this point, and even experiences here within the region. We also have to be concerned about the global economic fallout. So how do we solve the problem in the interim? My government has decided that it's going to introduce 2 packages. The first one is going to be a COVID rescue package. And that package started with our discussions with the central bank and the bankers here in order to make sure that people knew that they were not going to lose your home, you knew that you weren't going to lose your car, and that certainly whatever personal loans you had, they would not be called in on you. And that there wouldn't be the expectation that if you lost your job, that you would have to be able to find the money to pay off these loans. Between the national banks as well as the ECCB, very early in the game, they announced a carte blanche moratorium on principal and interest payments for personal loans, for business loans, and also for the government. We're working with the utility companies. I've indicated that WASCO has already indicated that anyone who was disconnected can get reconnected for free, and that you can be assured within the next 3 months that no one is going to be terminated. My conversations with LUSLEC continue, and my understanding is that it's going to a board meeting tomorrow, and that we'll be able to announce the package that LUSLEC is going to be able to provide to the general public. In terms of income support, my cabinet has already agreed that we are going to provide income support to the persons who have lost their jobs. What we have to make sure is that we have the mechanism in order to make sure that that is fair and that it's not to one sector in particular, but to all sectors of the economy that have been impacted. Both people who are in the formal sector as well as individuals who are in the informal sector and small businesses. This week, my conversations with the Taxi Association, hoping to meet with the Vendors Association, with the preschools. We're also continuing our meetings with the World Bank and the IMF and the Central Bank. And tomorrow, we're having the first meeting with the unions. It's important and imperative that we're able to meet with all of these individuals before we announce formally what our overall package is going to be. But let me reassure all St. Lucians that we will have a package in order to be able to help people with their income levels. I certainly would like everyone to also appreciate the position of government. We too have been affected. Our largest industry, which is the tourism industry, has gone to 0 arrivals. And therefore we have the loss of jobs, over 13,500, the loss of VAT revenues and other tax revenues that the government and the people benefit from. Many of the other companies have also been impacted severely, and so therefore their income to the government has been affected. I have said many times that we're also in negotiations with our bondholders. We have over $700 million in bonds that we have to roll over this year. Meanwhile, we are working with ECCB, World Bank, and the IMF that have recognized that this is unprecedented to find new mechanisms, new tools to be able to help the government create some form of liquidity. Because there's no point the government offering assistance and then on the other hand not having the resources to be able to fulfill that commitment. If there's one thing this government is going to do is to fulfill on the promises that it makes. Once we've been able to get through Corona, and I want to say to you tonight very clearly that the fight with Corona has only just begun. What we were doing before was attempting to keep it out. But we knew, and we always said, that that would just be in order to be able to help us get the infrastructure up to be able to support a breakout of the virus. And we succeeded in doing that. We've been able to move into OKEU and now dedicating Victoria Hospital as a respiratory hospital. And through the generosity of many hoteliers in this country, that we've been able to now get hotels which you can use for quarantine and eventually for isolation in order to support in this effort. Because we are going to need a lot of space. We remain internally gratified and thankful to the people and the government of Cuba for providing the technical assistance of doctors and nurses to be able to help us operate that respiratory facility. Without that, we would be in even deeper difficulties, as are many other countries. So the fight has just begun. We've seen in the United States of America that the President Trump has extended the period to April 30th. And many people even believe that that date is premature. Look how long and how many deaths have happened in Italy and in Spain before they have been finally seeing the number to plateau, and how long it took for Wuhan and for even China to start plateauing and starting to decline. So we're just at the beginning. And our future is going to be determined now by how we act. The more effective we are in social distancing at this critical time will make that determination. Are we going to be like New York City? Or are we going to be like Canada? Or are we going to be like Singapore or Taiwan that have managed their containment very well and been able to keep a flat line in order to make sure at no point that the health resources are exasperated or frustrated to the point that we cannot cater to people. And again, this is not just about beds or respirators. This is about the nurses and doctors that are going to have to work relentless hours to fight this battle. The more successful that we are in social distancing and flattening the curve, the better equipped that they're going to be if it's your turn or my turn or somebody else's turn to be on a respirator. If we don't adhere to these protocols, then sadly, we will see a lineup of people at the hospital that will not be able to get care. And all our nurses and doctors are human beings just like us. So the number of hours that they can put in any one day, or the number of hours they can put in a week, or in 2 weeks, or in 3 weeks, is limited. And so I'm appealing to all of you once again. Please adhere to these protocols. Please do not practice any form of civil disobedience. Understand that we are limited as it is. And the more disobedient that we are, the more that we don't practice the necessary discipline to adhere to these protocols, the more that we're stretching the same hand, stretching the hands of the people that we're going to need help from. So I can assure you that the government is working also on an economic stimulus program. But that economic stimulus program cannot come into effect until we've won the battle with Corona, and that we now know the solutions are free to walk around their country and to be active once more. And we're also going to have to depend on the recovery globally. So let's focus, all of us, the next couple of weeks on working together to fight Corona, to save lives. It could be your family member's life. It could be your life, or it could be your friends or neighbor's life. They're all important. But we need to hold hands, literally, but not to be disobedient. So again, I want to thank the CMO and her team for constantly keeping us up to date with the numbers. I know that she has some numbers. I'm not so sure if she's going to share them tonight with regards to what's the possibility fallout that we can see from a best case scenario to a worst case scenario. And they are sobering numbers in terms of how many people potentially can fall sick if in fact we don't adhere to these protocols. I also want to thank my cabinet colleagues. I want to thank the police officers and the nurses and the doctors. I want to thank the many people who continue to pray for myself and my family and the government, and also for fellow St. Lucians. I want to appeal to everyone to play their part. That let's truly be all in together in order to make sure that we can save lives together. So at this point, I'm going to pass back over to the CMO, who can share with you some of the numbers that we're facing and to understand the dilemma that Cabinet had. We are cognizant of the social fallout of forcing people to stay in their homes for 7 days. Please don't think for one moment we don't know how hard that's going to be. But we have to weigh that up with some of the numbers that the CMO is going to share with you. And also to understand that as a government, we must do everything to protect the people of this country. And I'm being honest with you, that if we allow this virus to grow out of control, we will not have the resources necessary to be able to save the number of lives in St. Lucia that we would like to. And we know that it's going to be hell if we don't. So again, I thank you, and be assured of our full support, and all the people who are concerned about whether they're going to have enough food, please know by calling 311 and getting in touch with NEMO that resources are being put in place to be able to facilitate your needs.
Dr. Belmar?
Thank you. We use our present numbers that we note in St. Lucia, given that someone with COVID-19 could transmit to at least 2 to 3 persons based on a contact with 10 to 20 persons. If we look at those numbers and we do the projections, projecting up to April 14th, the numbers that we look at are quite extensive. If we get doubling every 2 days, we could get numbers as high as 1,998. If we look at doubling every 4 days, we could get 226. And if we look at doubling every 7 days, we could look at 122. By social distancing and by the complete shutdown, it reduces the number of face-to-face contacts. It reduces the transmission, the possible transmission of the virus from one person to the other, and it significantly reduces the number of cases that we can note in the next 2 weeks. Based on the level of transmission and the interactions of our present cases, we anticipate that there are more cases than we have diagnosed to date. Our respiratory clinics, we have been very successful in our clients and our patients accessing care there, and we urge the public to utilize the various services that are available through our system. Our medical clinical lines have been shared where anyone can call and get direct information from a medical practitioner. Based on the level of disease, you'll be guided. If it's mild, you may be asked to stay home on medication, including paracetamol, rest, increase your fluids, and to keep your immune system up. If you develop respiratory signs and symptoms, and you have another condition such as diabetes, heart disease, lung disease, you may be advised to visit the respiratory clinic closest to you. And those are the Grozile Polyclinic, the Leclerc Wellness Center, the Soufrière Hospital, the Dennery Hospital, the Vieux-Fort Wellness Center, the Victoria Hospital, and also the Vieux-Fort Wellness Center. There is also a respiratory clinic at the St. Jude Hospital. These two, the St. Jude Hospital and the Victoria Hospital, is open 24 hours. So we urge the public. We also have the 311 line, which is open from 7 a.m. to midnight every day. So we urge the public, for general information, you can call 311. You can also utilize the cell phone numbers that we have shared, which are manned by physicians to provide clinical information to you if you are concerned about your health status. So we urge you to use the services. I also have to add in that testing is free to the population, and all care related to COVID-19 is also provided free of charge to the population. We depend on you to take all of the infection prevention control measures that we have been sharing in terms of cough etiquette, in terms of regular hand washing, and the use of hand sanitizer. The Ministry of Health, we are limited in terms of what we can do to protect you and your family. We need every single individual and every single sector to work with us so we can minimize the possible spread and the possible impact on us and our family.
Before we close, we have some final comments from Prime Minister.
Thank you very much, Nicole. Again, I want to remind everyone that we have asked the Attorney General to issue the order tomorrow morning, asking for the extension of this quarantine period or the shutdown of our economy starting tomorrow until the 7th of April. We're asking the general public to please adhere and continue to recognize the curfew, which ends at 5 a.m. tomorrow morning, to continue to recognize that curfew until 5 a.m. on April 7th. Also reminding you that all grocery stores will be closed, and those people who are in urgent need of food to please contact NEMO. And if you don't have the number, you can call 311 and they'll provide you not only with the number for NEMO, but will also provide you with the telephone numbers of all of the different health facilities around the island that will be open to be able to support you. Your government will do everything it can to make sure that we can win this fight. And I'm saying to you that we must win this fight. So we can only win it by working together and having confidence and faith in each other. I want to continue to thank the Lord for his blessings and continue many solutions who continue to pray for us and to pray for our country. And may God continue to bless you and continue to bless St. Lucia.
Thank you, Prime Minister Honorable Alan Chastenet. Thank you very much to our Chief Medical Officer, Dr. Sharon Belmar-George. Some of the key messages we received today was that St. Lucia recorded 13 confirmed cases of COVID-19. The Prime Minister has announced a 24-hour curfew, which starts from April 1st up to April 7th. Also, only essential services with written permission from NEMO are allowed to continue. St. Lucians are not allowed to go to the beach or for walks or, as the Prime Minister stated, visit a neighbor. One of the other key messages we received from the Prime Minister was that we are still in charge of our own destiny, but only if we follow the protocols laid out by the Ministry of Health and the government. We would like to continue to thank our partner stations, Daha Broadcasting Service, Helen Television System, Radio Caribbean International, The Wave, Wevent Radio, Choice TV, Great Vision Design TV, Calabash TV, NBC, Hot 7, Blazing FM and Kiss FM, Vibe Radio, Underground TV, and Hits FM. Thank you all for staying tuned with us. Continue to watch the NTN network for continuing coverage of COVID-19 and St. Lucia's response. Remember to stay home and stay safe, and stay tuned for an update in Creole.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
Bonjour, moi c'est Fenel Neptune, officier pour communication au département pour santé. Premièrement, moi kay bay l'adresse maître officier médical Dr. Sharon Belmar-George. Et qu'après, moi kay bay l'adresse du Premier ministre pour pays Honorable Alan Chastenet. L'adresse pour maître officier médical Dr. Sharon Belmar-George. Commencé janvier l'année 2020, le département pour santé a commencé différentes actions pour empêcher St.Lucia joindre maladie COVID-19 au pays. Aussi, en semaine qui passée, le département pour santé a aussi point action pour empêcher maladie COVID-19 si au pays. Après avoir joindre premier cas de maladie au pays. Effort ça est très important que le département pour santé voulait couper à son manière et qui affecte le pays et le secteur santé si maladie COVID-19 a simé à sous différentes communes pays. Nous avons action comme couper à ce voyage pour les gens qui sortent du pays côté maladie COVID-19 a simé en chaille. Nous aussi mettez facilité en place pour traiter et point qu'à gens qui méritent ni maladie COVID-19. La tenue aussi établissement dit Center Quarantine. Yo va forcer les affaires d'éducation et communication à société pour public là. Yo coupé à sous visitant moun sa rester dehors et aussi visitant ces places business là ça ouvert. Et pour ça là c'était pour renforcer les affaires de social distancing. Toutes ces actions ça là département pour santé et gouvernement point. C'était pour couper à ce maladie COVID-19 qui a simé au pays. À ce le 13 mars, St.Lucia a confirmé le premier cas de maladie COVID-19. Deuxième cas là a confirmé le 14 mars. Troisième cas là a confirmé le 16 mars. Et quatrième cas là a confirmé le 28 mars. À le 29 mars, le département pour santé a confirmé un lot 5 cas maladie COVID-19 et le 30 mars, il a confirmé un lot 4 cas de maladie COVID-19. Après ça, cette liste a fait record de 13 cas maladie COVID-19. Toutes ces cas maladie COVID-19 qui le département pour santé confirmé, étaient faites à peu près 2 semaines. Département pour santé quoi qui malgré yo ja confirmé maladie COVID-19 ka sima différentes communes au lieu pays yo aussi concerné qui yo pas ka point action pour si yo pas joindre maladie bagay qu'on laver la main yo couvert tousser et estené et les autres bagay yo ka wè qui moun pas ka point ça servir assez. Département pour santé aussi jabay commitment yo pour couper et contrôler manière maladie COVID-19 qu'a simé en ces différentes communes ou les pays. Ça c'est pour assurer protéger santé tout citoyen pays. Aussi, maître officier pour médical Dr. Sharon Belmar-George parler dit c'est pour raison ça là il nécessaire pour mettre plus système et action en place pour couper à ce risque maladie COVID-19. Après ça, nous allons mettre un petit pèse à sous l'adresse Premier ministre pour pays Honorable Alan Chastenet. Premier ministre Honorable Alan Chastenet aussi fait recommandation pour fermer toute bagaille en pays, ça veut dire shutdown pour 7 jours. Shutdown ça là, qui commence mercredi le 1er avril à seke bon matin et kay vin yo bout mardi li 7 avril à seke bon matin. Ça vle di, tout moun bouise weste la kay yo pour 7 jours et pas ni pour aller pièce côté. Un moun sa seulement aller dehors si yo joine permission hors organisation pour ménagement des as NIMO. Moun pas supposé aller bord la mer, aller marcher et ben aller la kay moun qui ka weste pour yo. Moun sa quitte kay yo seulement si yo ni un problème de médical qui bien sérieux. Pour moun qui bouise sa yo kuye emergency supplies hod NIMO, yo sa kuye li mo 3 yon pour assistance. NIMO ek police la ni responsabilité pour délivrer manger pour ces gens pauvres là et vulnerable. Di wata sa la pièce supermarket pakay ouvert. Di wata sa la aussi, la kay aussi ni différentes facilités santé ouvert comme polyclinique Gozele, Centre Santé Babono, le Cléry, Castouille, Besson, L'Aquamingo, Mikou, Vieux-Fort, le Slawe, Kanawi, l'hôpital Denwi, l'hôpital Soufouye, l'hôpital Victoria et Owen King EU. Premier ministre là aussi kouya sous St.Lucia pour jouer gros pas pour assurer maladie COVID-19 par simer un pays. Et puis c'est comme ça nous venons au bout de conférence là. Moi c'est Fenel Neptune, moi ka oui merci pour attention.
It's power bike time!
Hey, you need to cover your mouth. Don't you know about the coronavirus?
It's not a joke, it's a serious thing.